What is medical coding? Oftentimes people confuse coding and billing and they think they're one and the same, but they're actually two separate careers. So the medical coder will take that written word, translate it into numeric data or code sets, and that numeric data is what's given to the biller, and the biller's job is to make sure the information gets sent appropriately to the insurance carrier for processing. So medical coding happens before the bill is generated. And medical coders use three sets of code sets. Current procedural terminology, or CPT, that's what the physician did or the service that he or she provided. The diagnosis code, or International Classification of Diseases, 10th Revision Clinical Modification, that's a mouthful, or ICD-10 CM. And that provides the medical necessity or the why the doctor did the service. And of course, we can't forget our HCPC codes, our Healthcare Common Procedural Coding System. And that gives us codes for things like supplies and drugs and durable medical equipment. So coders are important because they'll review the information before it goes to the biller, make sure it's compliant, and make sure we have the right code sets. So what are the benefits of certification? Well, currently the job market for coders is growing so rapidly, it's actually double the average rate across the other industries. So there's a big job market for it, as you can see with all the various opportunities that are listed at the bottom half of this slide. Most importantly to note, though, is that coders who are certified actually get a 30% increase over those who are non-coders. So what are some of the opportunities? Most people, once they become certified, will have no problem finding jobs in a hospital setting or physician practice. But when you're looking for your job search, remember, to also look at billing companies, look at insurance companies, look at consulting companies. All of these aspects are where medical coders are desperately needed. Additionally, coders will work as educators. You'll see them out in the field speaking at national conferences or American boards. And if you really want to think a little bit out of the box, healthcare attorneys need medical coders. Yep, they need them for expert testimony to help defend their clients in an audit situation. Additionally, physicians who are selling their practice, the healthcare accountants will also call upon medical coders to determine if the amount of money or reimbursement that this practice had generated was done compliantly, and that's also done by checking the code sets. And most importantly, where I know most people are looking, is working from home or remote coding. So there are many aspects to look for. Hospitals usually have a lot of remote coders, and there's also a lot of consulting companies that offer remote coding opportunities as well. So you want to make sure to check the entire job market. There are many different types of certifying organizations, but the two that are on this slide are the two most nationally recognized. One is the AAPC, or American Academy of Professional Coders, and the other is AHIMA, or the American Health Information Management Association. Both of them are great. Both of them will cover all three of those coding books that we just mentioned, and additionally, they will cover medical terminology, anatomy, and physiology. Which one would be right for you? Well, it really depends on what you're looking to do. So if you're more hospital-driven, the AHIMA certification would probably be a better choice for you. That focuses more on the diagnostic coding, and that's what seems to be the focus for the hospitals on how they get their reimbursement. If you're looking to work more in an outpatient setting, the CPC credential, Certified Professional Coder from the AAPC, is a good choice. That's really for physician outpatient services, whether they're working in the emergency department or clinic or even hospital setting. There are professional components that would be coded by the CPC as well. The next question I get a lot is, are we going to be replaced by technology? And I think the resounding answer to that is no. Medical coding is really here to stay. First of all, just look at the job market and the opportunity that's out there. But most importantly, we do have a lot of tools, a lot of electronic tools and software that helps us. There's this coding assisted software or computer assisted coding, the CAC. We also have Encoder Pros, and also with the electronic health record. But all of these tools are there to assist the coder, not replace the coder. So none of these tools can actually determine medical necessity. They can calculate for sure, but the human aspect isn't there. Additionally, expert testimony needs to be done by a human or an individual. So coding is definitely here to stay, and with outsourcing as well, while some of the work might be outsourced, most of it is actually the billing that gets outsourced and not necessarily the medical coding. So what's required for certification? Well, all you need are three things. You need a high school diploma or a GED, membership with a nationally recognized certifying organization, and of course you would need to pass the examination. More importantly are the skill sets of the coder. Coders are usually very detail-oriented people. You should have good comprehension skills, good communication skills, and you need to be a team player. What I always recommend is any course that you're interested in taking, see if you can sit in for 10 or 15 minutes to see if this really is the right career choice for you. I guarantee you, once you start to see the format of the class and how the code sets work, you'll be able to make an educated decision as to whether or not this is the career choice that you want to go forward with. You can become certified in many different ways. This slide is listing online courses, which are good. It just really depends on how you best learn. But with medical coding, you really need to be able to bounce that information off of an instructor or have somebody that you can ask a question to, or at the very least get detailed rationales as to why your answer was right and wrong. Okay, so you want to have it both ways. Schools are also a good choice as well, but a lot of the schools, if you look at their curriculum, are not just focused on medical coding. They also put in billing and some other courses that might not just be focused on the medical coding, so that tends to go a little bit longer. Additionally, lots of the schools don't have proctors to proctor the examination afterwards. And of course, there's the certification prep courses. Those are good for people who just want to focus on medical coding. They want to take the exam and get started in their career. Actually offers a certified prep course that we'll talk about shortly. So do your fact checking. This is really important. First, you want to determine which is the right credential for you. So you want to check out those organizations. You want to see the difference between the AAPC and AHIMA. You want to determine if the instructors are certified as instructors. So some of the instructors are certified as coders, but they might not be certified instructors as well. And the difference is, to become a certified instructor, you need to go the extra mile. You need to have been working in the field for a period of years. You need to take some additional courses, and you need to pass another test that basically shows you have the ability to convey this information to students in a manner of which they will understand. Check the course curriculum. What is it focused on? Is it really focused on the coding system, or do you have to take billing courses and some other courses as well? And look at the fees. Check to see what's included with the fee that you're paying for that course.
We're going to code a scenario using ICD-10-CM. In this scenario, you're going to learn how to use the neoplasm table. First, I'm going to start by reading the scenario. This 50-year-old female was diagnosed with left breast carcinoma 4 years ago, at which time she had a left mastectomy performed with chemotherapy administration. She has been well since that time with no further treatment except for yearly checkups. The patient is now being seen with visual disturbances, dizziness, headaches, and blurred vision. Workup was completed, which revealed metastases to the brain, accounting for these symptoms. This was identified as being metastatic from the breast, not a new primary. What diagnosis codes are assigned? In this case, the breast cancer was previously excised with no further treatment directed at that site. So we're going to code that a little later as history of breast cancer. This time, we're looking at the metastatic cancer to the brain. So I'm going to begin by going to the neoplasm table. It's right after your alphabetical index. I am going to look for brain. The neoplasm table lists all of the body parts in alphabetical order. So I'm going to go down alphabetically and find brain. And remember, there's subheadings under a lot of these body parts. So don't stop looking too soon and think you haven't found brain. And I found brain NEC. And now this is a metastatic cancer. It is not the primary. The first column is for malignant primary. The second column is malignant secondary. Cancer in situ, benign, uncertain, or unspecified behavior. We're going to use the malignant secondary column. So the code for brain NEC is C79.31. So now I'm going to turn to the tabular list and verify that code. I'm going to turn to the C section and look up 79.31. And I found the code. It's secondary malignant neoplasm of the brain. And that is correct for a metastatic cancer. So that's my first code. That's my principal diagnosis. Now I'm going to look at the scenario and figure out what else I need to code. Remember that I mentioned that the breast cancer had been excised previously, and so we're going to code that as history of breast cancer. So I'm going to go back to my alphabetical index, and I'm going to look up the word history. Notice when I first find this section of the code book, initially I see family history directly under history. So I need to make sure that I go down further and find personal history. And I found that right here. So now I'm going to look for malignant neoplasm, which is generally how we refer to cancer when we're coding. I found it right here, and I go down and I find breast. And the code is Z85.3. So now again, I want to go to the tabular list and I want to verify that code. Near the end of the code book, Z85.3. And I found the code. Z85.3 is personal history of malignant neoplasm of the breast. So is there anything else that I want to code? Let's take a look at the scenario again. The patient had a mastectomy and also had a personal history of chemotherapy. Since those are related to this metastatic cancer, we want to code those as well. So I'm going to look up the mastectomy, and that is absence of a body part. So I'm going to go back to the alphabetical index, and I'm going to look up absent. It takes a little practice to get familiar with what terms to look up in the alphabetical index. And it's really important to learn what to look up, what terms to use to look up a code in the alphabetical index before you try using an encoder. An encoder is a computerized way of looking up a code, and it can lead you down the wrong path if you don't know what terms are used in the code book. So I'm going to look up absent, and I found absence, and I want to find the body part of breast, and I found it right down here, Z90.1, and then there's a dash with a check mark. That means I need an additional character in this code. The code is not complete if I just use the Z90.1. So I'm going to go back to the alphabetical or the tabular list, and I'm going to look up Z90. Z90.1, acquired absence of breast and nipple, and I look down in the subterms under that, and I find that there's one specifically for the left breast. A lot of codes in ICD-10 have right, left, and bilateral characters. So my final code is Z90.12. I also want to code the history of chemotherapy for the neoplasm. So I go back to the alphabetical index and I look up history again. History, and I make sure I'm at the section with the personal history, not family history. And I find chemotherapy. And here's the code, chemotherapy for neoplastic condition, Z92.21. So this scenario has 4 codes. I want to also verify this in the tabular list by going to Z92. .21, and the complete code description is personal history of anti-neoplastic chemotherapy. So that's the correct code. It's a complete code. There's no little red check mark next to it showing that I need additional characters. There's no additional notes related to this code that I need to pay attention to. So I have my 4 codes, and they are Z79.31 as a principal diagnosis, and then as other diagnoses, Z85.3, Z90.12, Z92.21. And that completes the coding of this scenario.